checking in if there was anything that happened that was interesting this week or that you learned or a cool
Hmm,
thing that a patient said. I'm curious if there's anything that's popped up for you like that.
that is a great question.
Yeah.
So it was actually, I think, the end of last week. I had an appointment with a patient who I've known for years, who I hadn't
Mm-hmm.
seen. I think in this last year, I'd only seen her once. And so she made an appointment just to catch up to share with me how well she's doing. So
Mm.
that was super duper exciting. And
Yeah.
she was doing amazing. So from the first time when I saw her, she was almost maybe still a little bit catatonic.
Mm-hmm.
And now at where she is now, she just got her all-time dream job.
That's amazing.
So to see the transformation for her was so, so incredible. And
Yeah.
I feel like the whole week since then, for me, it has just given me more of a sense of how possible it is to heal
Mm.
and how much a person can heal.
Mm-hmm.
So now when I'm helping people when they need hope, it's like I got it. Because they're not having it so much. They can't feel it so much because of med withdrawal
Mm-hmm.
injury. Because that's what happens very, very frequently. A hallmark effect of psychiatric medication withdrawal is the feeling of a loss of ability to anticipate improvement in the future. So
Mm.
essentially, hope.
Yeah.
And they'll be looping
Wow.
thoughts of fear, looping thoughts of, I'm always going to feel this way. I'm always going to feel this way. It's never going to get better. I'm the special case that's not going to heal. It's somehow different for me, that. And I've seen it too many times to count and then watched those people get better. And just for her, it was so stark because she and she had been through a lot and had been through multiple providers who did not believe her and were not
Uh,
helping her, and who unfortunately and unknowingly worsened things.
mm-hmm.
And then to just see her sparkling and shiny and happy, and yeah. Yeah,
Yeah.
exactly. So that really was a thread for my week, because a huge part of my role is the holding a strong pillar of hope for people.
Mm. Mm-hmm.
Because when your brain has been hurt by a chemical and it's going through biochemical changes relative to that, it's just people are not clear thought, and the same kinds of thinking are not available
Yeah.
so easily.
Yeah.
So a lot of my role is it's a lot of things, but that's one in particular. And so to have that kind of a boost. I can never forget seeing her face. I literally will think of her face when I'll see somebody. I'll be like, nope, you're going to get better. And when I first started doing this work, I did not know that.
Mm.
I didn't
Mm-hmm.
fully understand. I had hope. I had read a bunch of stories, I
Yeah.
read and watched people's things online or watched Medicating Normal and seen amazing recoveries, but I didn't personally know, and I didn't personally know what that takes.
Mm-hmm.
And it takes a lot more than I understood
Yeah.
to help somebody navigate that kind of journey.
Right. Yeah. So it's been a process for you too of like
Oh,
seeing the hope in action, right? Of like, okay, you always kind of believed it, but seeing it is a different thing.
yeah. Yeah,
Yeah.
seeing it and understanding, because also there's also the technical part of it.
Right.
There's the literal medication dosing and decisions about, how long to hold certain doses, and that's part of it. Um, so it's like complex, because there's psychological, mental, and emotional support giving. And then there's also like, okay, the calculating part.
Right. Right. The
So,
logistical, like, yeah. Yeah. How
And then
is it?
those, oh, go ahead.
Yeah, I was just gonna say that's something that I've always been curious about in the work that you do is kind of holding both of those and saying, okay, we know your brain is hurt. We know it feels hopeless right now. And here are some steps to do. Like here's right, like the kind of path that we're gonna go down. Um, and the trust that people have in you, to say like, all right, I'm feeling this kind of way and it's horrible and I don't know what to do, but I'm gonna try what Dr. G says. Like, yeah. Tell me your thoughts on that.
Yeah, that is such an incredible point. It takes immense amount of trust. I think I've also learned that, or that's been really, I think each one of us in our roles of these kinds of roles is maturing and growing at the same time. I hope so.
Mm-hmm.
Like you said, like it's been transformation for me too. It
Mm-hmm.
absolutely has. I think that's something they should preview you for in your medical training.
Yeah.
They should say you should grow and change through this process. That's important. It's a huge piece
Mm-hmm.
of it. So understanding that trust piece, I think I'm still learning even now, like 4.5 years later of doing specifically this kind of work about what that trust component means.
Mm.
I can see now, I can recognize it, and I have more and more awareness for it now and respect for it now than I used to, as in understanding how big that feels for somebody to trust their mental state to me, or
Yeah.
take me on as a partner in them making decisions about something that is going to impact their brain chemistry.
Right. Right.
I can't, I have such a much more immense respect for what working with or altering brain chemistry, what that means.
Mm-hmm.
That is a huge, huge monumental thing. I now
Yeah.
point that out to people. Like when we first get started, I now have kind of
Mm.
a thing that comes up now every time of like, I wish this would have been told to you before you ever swallowed the first pill.
Mm.
So the journey we're embarking on and using any substance that alters your mind
Mm-hmm.
is a huge deal.
Mm-hmm.
And it requires and merits a ton of
Yeah.
respect and or humility
Right.
about
Right.
treading into something that changes your experience of life.
Mm-hmm.
The
Mm-hmm.
fundamental aspect of being a human being, our perception, the way
Yeah.
our mind functions, I think
Right. Well, the identity shifts that people talk about too. Like, I mean, I have not heard nearly as many stories as you, and I've heard plenty of like, I feel like completely different. The before meds, on meds, and after meds are like three different people.
I love that.
Yeah. Yeah.
I couldn't
Definitely.
I couldn't more agree with that. I couldn't agree with that more.
Yeah.
Uh,
Yeah.
yeah.
I think that's something, and I know there's many conversations out there. We don't have to get too into the weeds with it, but one of the major issues in common psychiatry is just talking about these medications like they're, you know, insulin or ibuprofen or like, right. And it's so much different to mess with the metabolic process than it is to mess with your brain, which is then therefore like your identity and your perception of the world and like all of these things. Like that connection is one that um I'm still learning about, frankly, and like kind of really, it's one of those things where the philosophy side of my brain is like, well, a brain thinking about a brain thinking about a brain, like right? It's this sort of like multiple levels of awareness, like it's really trippy. Um, but I see how it's a thing that people have like grossly underestimated. Um, and how it's a really challenging process to like go through. And
Yeah.
yeah.
Yeah, I think that's interesting. That's a super interesting point. And there was when the whole realm of psychiatry was getting more and more medicalized,
Mm-hmm.
as in the attempt to turn this into so much of a science or
Right.
something that appears like a science. What we have to understand, and I think people just don't understand, we can go into your vein and draw blood and measure the amount of sugar in it. We can measure
Mm-hmm.
your blood sugar. We can measure insulin levels.
Yeah.
Nobody has ever gone into a human brain and sucked out all your serotonin and measured it.
Right. Because you'd
Nobody
have to
ever.
like do a spinal tap to do like, and that's not even, you have to like go into the brain.
We wouldn't, I think, even know how,
Mm,
because maybe there's some of the serotonin's occupied in receptors.
right.
Maybe I think we wouldn't, at this stage and phase of our evolution as scientists, we wouldn't even know how,
Mm,
to capture that data. And I
yeah.
think that general public doesn't so much realize that. And it comes back to the trust word that pops in my mind of, people kind of just trust what their doctor says as the one
Mm-hmm.
that's interpreting the science and then
Mm-hmm.
saying, okay, this is what you need.
Mm-hmm.
And I think we're entering a different era, a very fascinating era where people can get way, way more empowered with information, research, and data.
Right.
I mean, I feel like we're absolutely in a strange era where a lot of times patients are knowing a lot more about their condition, their drug, their own reaction to it than the doctor.
Mm-hmm.
But coming back to, being told that taking these medications is like a person who has diabetes taking insulin. That's not accurate because we've
Mm-hmm.
never measured your serotonin level
Yeah. It's
and
all
then
based
checked it.
on theory.
It's based on theory. And then the theory, I mean, there was the meta analysis done a couple of years ago that showed that we have never proven that low serotonin levels cause depression. That has never been
Mm,
scientifically proven. So now we're
yeah.
operating, the operating under a premise that's now been proven untrue, inaccurate, or
Yep.
at least unproven.
Yeah. Yeah. The way that hypotheses work. Uh-huh.
Yeah. So it's complex. It's nothing short of complicated and
Yeah.
complex. And it's not,
Yeah.
there aren't circumstances or situations where, I mean, sometimes the tool of a psychiatric medication is helpful.
Sure.
But I think kind of similarly, what we figured out about opiates used to be, okay, however much a patient needs an opiate and whatever their pain score is and level, okay, just give it, give it, give it.
Mm,
I was just talking to an ICU nurse, and then she said, now it's Motrin. In the
mm-hmm.
hesitancy and the barriers to even implement the use of an opiate now.
Yeah.
And I think that unfortunately, for whatever reason, I think that's coming for psychiatric medications. I could almost guarantee that that's coming.
Mm,
We will come back to a point where these should be things used for last resort only.
yeah.
Last resort, if there's life-threatening situations, if there's urgent situations, last resort. And in that case, maybe it's the appropriate tool, but certainly giving full informed consent, full education to the patient and or their families about what this kind of substance does and or can do, the risks.
Right. Right. Yeah. And because that informed consent piece is huge. And I think so much of like if the medications themselves aren't great, right? Like, yeah, I totally agree. Select times and cases, they're there. And it feels like so much of the harm that's been done with them has been because of like miseducation or just plain missing education, like people not knowing that, okay, you can start this thing and then you have to come off of it very slowly. Like, yeah. Um, I'm kind of curious to go back to this trust piece. It keeps popping up for me too. But also in relation to this evolution that we're all seeing in the medical field and people knowing, right, a lot about their own selves and their conditions and like what's going on, the excess of research, excess and access. um Maybe not always excess of research, but of information, right? Whether it's based in research or not. And then like going with that to healthcare providers who don't always know what to do with it or how to handle it. And then there's different ways that they react to it. But I think of this idea of partnership that I know has been really important to you in your work with Drew U and just I think in this evolution as a field in general. So I'm curious to hear your thoughts on that kind of trust in like a partnership, not necessarily a I'm your doctor, trust me to tell you what to do kind of thing, because that's not quite what it is.
Yeah. I think those days are going to dwindle.
Yeah.
And if you think about it, even the evolution of human beings, it's like literacy, just
Mm-hmm.
the fundamental thing of being able to read, used to only be held by a small group of people. And that gave them power. That was the power differential.
Mm-hmm.
Where we are now currently in the evolution of the earth or humanity,
Right.
is you know, most all of us have the empowerment of being able to read, fortunately. And now with the advent of the internet, it's just exploded in terms of our capabilities of being empowered through knowledge or empowered through education and information, which is incredible. And it's kind of a fascinating time to be alive to see this happening because the
Mm.
power, anything where you people can have information, the power differential, wow, does it really start to, you know, even out? And
Yeah.
then
Yeah.
so the trust piece, eh, which is a huge thing. I feel like I could talk for hours about it. So
Yeah.
here's how I experience it now, and then maybe I'll back up to where I was. Now what I realize is that trust piece, it's not them trusting me as their doctor to, lead them and say, here's exactly, I know the exactly right thing for you to do and do it. The playing field is completely leveled in my experience of it. It's the trust is mutual.
Mm.
I cannot do my job without the expertise of that individual because they are the number one world's expert on themselves.
Mm-hmm.
I can tell them all about whatever I know and whatever I've observed and experienced with working with lots of people and what I've learned and understand and know about medicine and human health. But in the end, applying that, making use of that in the context of each individual has to. It's to me, there's no, I mean, unless somebody's unconscious,
Right.
or once in a while, if there is an illness that's preventing them from being able to access their own observation of themselves, then they sometimes have to rely more on me. But it's a coming together of our agreement and or them sharing their observation, their lived learned experience about what they've gone through with the psych med and or their own mental health. I bring my education information, and it's a total team effort. Total.
Mm.
We never make a decision about a med reduction without us both agreeing. I don't ever do that.
Yeah.
I used to do that. I
Mm.
used to come in as the doctor. Okay, I know, and here's the doses, and this is this dose and that, and this is the optimal. I used to come in like that
Mm.
because it's culturally how we're
Yeah.
conditioned.
That's what you're taught to do.
We're
Like,
taught to do that. And
yeah.
even outside of medical training, just in the world, people kind of go like, oh, doctor, okay, it's like, we don't. We're
Mm,
learning. That's, to me, that's a way more realistic attitude. Yes, we know a lot. Yes, we've gone through almost a decade of training. Yes, we do know, and we don't know a ton. And I
mhm,
think the more and more with the internet and AI, it's exploding about the limitations of a doctor as a human being alone,
mm,
operating as if they are the know-all. We're not.
mhm.
We are not the know-all. And it's getting proven. I just recently saw some study about AI, and they compared diagnostic capability of AI versus, like, I think 10 physicians. Guess who won?
Oh gosh.
Yeah. So I'm not saying, doctors absolutely, a human absolutely belongs in the process. We belong.
Yeah.
There's no way, I think, in the subtleties of all of it, it AI could eclipse the function
Yeah.
of a human in the process, but man, can they provide a lot of helpful support.
Yeah,
I
as
know,
far
I
as
know what my brain's like. I know what my mind is like. It ain't perfect.
yeah. I mean, quick side tangent. Yeah, I can totally see. I mean, and AI is something I am not very educated on, but in that kind of realm, like just the ability to synthesize information and apply, like to take a set of symptoms and scan through all the different diagnoses and kind of add up numerically, right? Like yeah, let's use computers for that, but then should a human look at those options and check and be the one to, like, yeah, absolutely. um
Yeah.
yeah, I love this idea of the meeting, like the meeting of the minds, right? The expertise and the training and the experience and having seen a lot of cases at this point, and the like, this is me and my body and my brain and what I'm feeling and experiencing, and there's like multiple levels of trust. Like, you have to trust what they say. You have to believe them, right? I know we've had conversations about how powerful that is. um they have to trust you that you are believing them, that you're being honest in what you're saying and the information that you're giving. And um but then there's also this, like, I think the patients have to trust themselves a little bit. I mean,
Oh,
more than a little bit. Like, I imagine that's a thing that builds in the process. They probably come in not with much of that, but then um and you also have to trust yourself, right? To show up in the way
yeah.
that, in a humble, like, humble yet kind of confident, right? You have to be this pillar which is solid and strong but also hopeful, like you said, like we were talking about earlier. But yeah, I mean, you had that reaction. I'm curious to hear your thoughts about self-trust in people going through this tapering process.
It's my favorite part of it.
Yeah. Hmm.
It's my favorite part to watch somebody who's, like you said, there's the three phases. There's like the before, or when they were on the meds, when they're coming off, and after, or however
Yeah. Yeah.
chunk that up. But it's my favorite part. It's my favorite
Mm.
part to watch people start to truly understand they can trust themselves. That, I would say, if there was one, like, archetypal thing about this process, about somebody who wants to taper or come off their psychiatric medications, it's that
Mm.
they start to understand that their intuition is worthwhile, that their assessment of their own inner experience is ultra worthwhile.
Yeah.
It's so beautiful to watch a human being get more and more of a sense of empowerment, inner trust, because with that comes a lot more peace,
Mm.
a lot more peace in just living life in general, because that will apply not just how they've gone through their psychiatric medication tapering, that will apply to every aspect of their life.
Mm-hmm. Their relationships, their work, their families, like everything.
Everything. And I've heard that the person I mentioned who came back
Mm-hmm.
last week to tell me about how well she was doing, she even said like life's a little different now.
Mm.
She says the joy she feels now because she remembers how bad she felt,
Yeah.
and that she, coming through that and kind of realizing that she was right about herself all along, that
It's
something was.
it struck me that I was like, oh, maybe that sparkle, that glimmer, like is that the self-trust, that you said you saw in her when you met with her.
Yeah,
Yeah.
self-confidence, self-trust.
Mm.
Unbelievable to see people experience that. It's like there's a glow, like when I'll first see people and they'll be so struggling because they're destabilized because they've been getting, unfortunately, inaccurate guidance about how to deal with their med, and they'll be destabilized. They'll be an abject misery, abject, the words miserable, horrible, worst experience of my life. I've heard those more times than I can count.
Wow.
And then to watch somebody go from that to freedom is pretty darn inspiring.
Pretty cool.
And then the other trust part of the piece of the puzzle, certainly for me, was in the beginning when I was first learning about this whole thing about needing to taper and or what psych meds can do to people in a very negative way. At first people were telling me things. It was hard to believe because I
Mm.
had been so deeply trained about, no, this is how it is and it's exactly like this, and if it's anything other than this, it's that person's mental illness.
Right.
But when you actually start listening to and believing people, and at first I was like, oh wow, really? Withdrawal from Zoloft? Really?
Mm.
Like, I mean, I knew benzos, okay.
Sure.
It
Right.
was, but then the more I started to believe and trust the people I was hearing, just
Mm-hmm.
now as I reflect on it, which is just basic human decency, it's just
Mm.
basic human decency to listen to a person and believe them,
Yeah.
at least giving people the benefit of the doubt. Now,
Right.
after hearing hundreds of people's stories, it's so obvious. It's obvious. People aren't making this up.
Mm-mm.
It's not mental illness. Withdrawal from a psychiatric medication is not mental illness.
Mm-hmm.
It's withdrawal from a chemical that changes a person's brain chemistry.
Right.
And why is that? I don't think that's at all a stretch when you think about it. When you're taking a mind or brain altering substance on a daily basis, and suddenly you're going to abruptly stop it or abruptly reduce the dose by a big percentage. Of course, a person's going to struggle, and it's going to look like a lot of mental health symptoms because it's the brain.
Mm-hmm.
And we know it affects people's moods.
Right. Well, I mean, perhaps an oversimplification, but like if something's wrong with your knee hurts. It like expresses problems in pain, right? If something's wrong with your brain, it changes how you feel. Like that's how it expresses because it doesn't like your brain doesn't have pain receptors. I don't think it does, but like it's not right. You're not going to be like, ouch. And people do kind of have that sensation, but it's a little bit different. Physically, like you guys guess you can get headaches. I'm talking myself in circles here. Um, but yeah, like that kind of it's like that. So we talk about in the holistic somatic, like talk about listening to the body and what it's saying and honoring what it needs. So like how are we listening to the brain and what it's like, right? It's this beautiful organ that allows us to think and feel and experience and perceive the world. And it's also a physical part of us. Like it's got that element too. Um, like the brain and the mind, and then spirit, the soul, and all the things. But
Yeah.
yeah, it's a cool way of understanding it, I think. Like,
Yeah.
mm-hmm,
We are
mm-hmm.
complex creatures.
So
We are complex creatures. And I don't know, maybe people don't realize it. Like we haven't our studies of the brain, I mean, relative to the complexity of the organ, in my opinion, are pretty darn limited.
oh yeah,
Because think about this in the complexity of, okay, yes, we have brains, and then there's this concept of the
yeah,
minds, and the nature of our persona and a personality, what actually
mm-hmm.
makes that. And so when we go in there and we tinker with that, I don't know, that's a big deal.
Yeah,
Because we're treading into a place where I think if we can acknowledge how much we don't know versus
mm-hmm.
how much we know, I think
Right,
part of our trouble has been as humans is to kind of rush forward, maybe a little arrogantly, rather than like, oh, wait a minute, because like, again, just to, call back to the opiates. Okay, maybe studies may have been done that showed certain things, but really it was actually the mass human experience of the use of that over decades that helped us understand, oh, whoa, wait a minute, those aren't what we first thought.
right,
It was the mass human experiment. Because how we vary as individuals, I have way, way, way more respect now than I ever have for how
mm-hmm.
much we vary as individuals. Yes, we're very similar and the same in our biology and our psychology, and we greatly differ. Somebody can go on and off Lexapro multiple times and have no issue.
Mm-hmm.
And somebody can go on and off once and be completely derailed and struggle and have a lot of difficulty because of their biochemistry,
Right,
not because of their psychology. It's not something somebody can think their way through when you've disrupted brain chemistry.
mm-hmm.
Vast differences, which again, if we can just have the respect for that and then tread appropriately into those
Mm-hmm.
realms, give the informed consent, give the risk, give the the list of potential risks to people
Yeah,
before they're going to make the decision to tread into that area. But truly, we need so much more, I think, reform, for lack of a better word,
mm.
is in the medical and or scientific community, or truly the medical, you know the powers that determine and influence how we apply these things,
Mm-hmm.
that we can get, so that we can all get the accurate information as much as that's possible, and acknowledging it is hard because we're still, we are in a vast human experiment
Yeah,
in many cases for these things that we're trying to use as modalities to help people. But
right,
that just the acknowledgement and humility in the face of that, like, hey, these are the things we know, and these are the things we don't know, and here's the possible risks, in true honesty. And I think we're seeing a lot of this get put on hyperspeed with the
mm.
advent of the internet and or now
Sure,
with AI. I think it's really it's incredible to watch it unfold.
mm. Yeah. Um, the word humility definitely was just kept coming up for me as you're talking for this process, for what we don't know, for what we don't know about how the medications work, how brains work, the differences between individual people, like all of the things. I think that's so important. Um, I wonder too about, because I kind of feel this like little glimmer of hope for the future, for things that are changing and where things are going. I'm curious if you want to speak on that, on like what you're dreaming of.
I think tons of hope.
Yeah.
I think tons of hope. As sometimes as limited as we can be as human beings and as a species, we
Mm.
we tend to ultimately, and my favorite thing is the truth. And the truth seems to solve these things for us in the longer run.
Yeah.
We don't, you don't walk into your doctor's office and find them smoking a cigarette anymore or them encouraging you to. We don't use thalidomide anymore. We don't, we don't do lobotomies anymore. You know,
Mm.
the truth does end up setting us free, or it does. The truth solves a lot of our problems for us over time.
Yeah.
And I absolutely have faith that we'll get our stuff together in the realm of psychiatric medications. We'll get it together. We're trying in any of these kinds of changes that happen, because it's a cultural change. We're
Hmm.
needing to change a culture around it. And it's from top to bottom and bottom to top. We need a cultural change. It's coming. There's been, a movement for at least the last 20 years. Dr. Robert Whitaker's book, Anatomy of an Epidemic, and his advocacy and the work that he's done, and then others along the way who have also been major pillars of the movement, are still moving, and more of us are joining and getting on board. And the more
Hmm.
and more it reaches, it's like the noise has to turn into rather than people just blowing it off as noise in the background. It's starting to coalesce more and more with the number of voices that are joining.
Hmm.
There's 40,000 people in a Facebook support group for people trying to taper Cymbalta.
Right.
40,000. And if you look at the other Facebook groups or other groups that are online peer-based support communities that have galvanized around people trying to help themselves, because that's what we do. We try to solve our problems however we can.
Hmm.
The movement's growing. The voices are getting louder. Now, even on the political landscape, this topic is coming up. So
Hmm.
once it reaches regulatory bodies, once it
Yeah.
reaches government level, the regulatory bodies and or governing bodies, they're the ones that can, really, once they actually acknowledge it and say,
Right.
okay, and validate it, then things will shift faster.
Hmm.
It's been grassroots.
Yeah.
And grassroots has been incredible. It's how I've learned about all of this. It's all the education I've got, which is, it's weird when we're a culture that's forcing our providers to learn through, just online searches and all these other forums. Or we're literally, right now, the best information has come through patients themselves and
Hmm.
their collective voices, and advocates here and here going like, yeah, this is real.
Yeah.
That's where this is. I mean, it's time to acknowledge that.
Yeah.
Time to acknowledge. And, there's interesting shifts going on in the world for sure. And I'm so more than happy to be a part of. My whole thing that I ever even wanted to go into medicine for was to help people. That was
Right.
genuine. That was genuine. And when that's what you truly want to do, you'll welcome whatever it takes or whatever it is that's going to help people.
Hmm.
It's going to ruffle feathers. It's ruffling feathers. People get scared when they hear information that goes against what I was taught and what I was trained to do and what I was trained is right. But when you actually research the history of the information that you've been trained with, you'll find out that it's woefully lacking. There is no study that has ever studied people on antidepressants that's gone longer than a year. Got people on these for decades, and those people
Hmm.
have something to say.
Yeah.
I just think it's incredible. We now have the possibility of taking people's lived experiences, their reports, and turning that into quantifiable data. Fabulous, fabulous information.
Mm-hmm.
life-changing information. The
Mm-hmm.
way that we do medical studies in the world presently, and who's funding them, and how they can be massaged and or interpreted or
Yeah.
presented as an interpretation that may not
Right.
necessarily be accurate or may be conveniently interpreted.
Right.
Um, Now we have humans' lived experiences, and you won't get better than that. You
Mm-hmm.
won't get better than collective and the differences and the variances. Some people will say these medications save their lives, and I believe them. And some people, it's they're losing their lives at the hands of these medications simply because doctors haven't known how to educate them
Right.
about the proper way to handle them.
Mm-hmm.
And so you've got we're there, and but again, I think inevitably with something as powerful as AI, we will take that, shared report and information and turn it into usable data
Mm.
about how to more safely utilize whatever interventions we come up with medically, particularly psych meds, of course.
Yeah. Yeah. Wow. I know this theme of believing what people say. And then I'm also hearing that like this vision for recording that. Like A, believing what people say when they show up to a session with you, right? Like as part of your work with individuals, but then also believing what people say and recording that in the research at large, and in um one of my courses this semester, we're doing like a deep dive into the values of quantitative, right? Numbers, data, research versus qualitative, what people say, their experiences. And I know that I very much came from a background of like, data is king, numbers are the best. Like, I remember reading sociology studies in school of just like kind of interviews, and I was like, what's the point of this? Isn't it research? Like, this is right. And I was like, I didn't get it. I didn't understand it. I think there's a lot of people, like especially in the medical world, that they're all taught the same thing of like, if you don't have double blind and controls and yada yada, like it's not worthwhile. But what I'm hearing from you is this like, what if we just let it be simple? What if we just took what people said and like put it on a chart, and or right, like we can just recorded some stories, looked for themes. Like I would be curious if anybody's done qualitative research on like the experience of being on psych meds, coming off psych meds. That would be very interesting to read. But yeah, it's this kind of shift in it. And I think, right, like there's numbers are helpful, definitely helpful and powerful, especially in the world that we live in. And I think we need words too.
Yeah. Yeah, we
Mm,
need to believe each other. We need to
yeah.
give each other the benefit of the doubt
Mm-hmm.
first, rather than like, jumping right to, is this person really telling me the truth? They're telling you the truth.
Yeah.
That's for me was the huge, and that sounds terrible, but I just feel like, again, coming from how I was trained, I've only ever really wanted to help people.
Mm-hmm.
And I was trained in a way where I just felt like I'm helping people by being the authority.
Mm-hmm.
And that's, I mean, yes, there is definitely a lot of knowledge in my brain or in my mind.
Mm-hmm.
I just, and I don't know everything. I can't. And I cannot know. If you think about how unique we are as individuals, you can grow up in the same house with somebody and have completely different life and health
Could
trajectories.
you could be an identical twin
You can
and
be an
like live
identical twin and still,
right? Like, yeah.
yes, yes, yes.
That's why
So
twin studies are so interesting
it
because
is exactly right. So it's yeah, it's a shift. We're shifting from the overlord way of, disseminating information to we're getting. And then to me, it's the most fun. It's not, I'm going to say it's not easy work because people are hugely suffering and it's scary at times. I'm sometimes so scared at how much they're suffering because people are honest about it.
Yeah.
But something happens when we come together. It's like it's you and me, we're in this. And
Mm-hmm.
we both have one agenda. We have your well-being. That is our number one. You and I together don't care about really anything else except that.
Yeah.
When two people come together in that vein, like in that light, I think there's something really powerful that happens beyond what you can do alone or
Mm-hmm.
beyond what you could do as a dictator. It's not a
Yeah.
dictatorship. It was never going to work like that. And the problem solving that comes out to me when it feels more like, you know, we're on an even playing field is the problem
Mm-hmm.
solving is so much more intelligent.
Yeah.
It's in my opinion, because it takes into effect their present moment lived human experience.
Mm-hmm.
And that means everything.
Yeah.
So for the thing about doctors, and I know, and there are wonderful, I mean, doctors mostly we went into this field because we wanted to help. And we were willing to sacrifice a decade of our lives, a decade of income, a decade, and not to mention a house mortgage worth of debt. We were
Uh,
willing to invest all of that to have this job. So, there was some dedication there and willingness to sacrifice. And I know, and I remember what I was like when I first got started. I love seeing like new trainees and I see the freshness and the openness in their
mm,
faces. But if you look at the other end of the spectrum, and by the time doctors are a decade or more into their, experience as, practicing physician, there's a lot of burnout, there's a lot of fatigue,
yeah.
there's a lot of unhappiness, physician suicides. We lose a physician a day to suicide. That blows my mind that on average, we lose a physician, almost a physician a day to suicide. Like, yeah, something in the system, certainly needs to shift. And it's shifting, whether we like it or not, it's shifting. The landscape is shifting
Mm,
through the powers of the human evolution. It's shifting.
yeah.
I just
Yeah.
would ask physicians to almost like come back to themselves. I wish
Mm,
somebody would have told me more that early on that my intuition was not far off
mm,
about what was how to approach how to approach practicing medicine.
mm, mm-hmm. Yeah. It's powerful stuff. And it strikes me too how when doctors, practitioners like come back to themselves, right? Start to trust their intuition a little bit more, don't feel so wrapped up in the system and the have tos and the shoulds and the yada yada, like that it's better for them. It's better for their well-being. Like they are happier, more like what's the word I'm looking for? Um, like they're better doctors, they do their job better. And I think part of that is because when they step back, they're a little bit more humble. They're like, okay, I don't know everything. Let me see what my patient has to say. That then supports the patient in building their self-trust and their confidence. I mean, like the whole self-awareness journey of, right, like me as a counselor in training, that part is really fascinating. Um, of yeah, like, okay, somebody's asking me what I'm experiencing, I'm telling them, they're believing me, then all of the steps that follow after that, it's like a, on one hand you'd be like, it's a win-win, why not? But there's so much, it's hard in the way, it's really hard in the way that the world is set up, and that especially like the US healthcare system and all of that makes it really challenging to do that. And it's this kind of like undoing of training that so many practitioners have to go through. And I think there are like select few people, right, who may come out with a more open mindset, or have an intuition and never quite lose it, kind of thing, like you described. But yeah, you've made me a little more excited about where things are going, a little more hopeful about what's in the future. And I'm glad that we've got voices like yours, like in this process, um, to be honest and humble and speak truth about what you're seeing out there in the world, like to be an advocate and a voice for all these people who suffered so much. So I know compliments are hard.
Yeah, I'm nothing. I'm a tiny voice. I'm just hopping on to what people really forged. Robert
Yeah.
Whitaker, Adele Framer, Mark Horowitz, David Healy, the people who have uh Peter Bregan, the people who've really forged. I feel like I'm almost like a late to the party person. Right. I'm just trying to help people making use of my medical degree.
I mean, don't sell yourself short. But I think you've got a really cool vision for what could be in the future. And I think people that have come before you did a great job of like calling out the problems of identifying things. But everybody's got their place in the process,
Yeah,
right?
we do. You're
Yeah.
absolutely right.
Yeah.
You're absolutely right. We all do have our own
Mm.
place.
Just as like every person who's going through a taper or who's in withdrawal, like,
Mm.
right? Every single who posts in a forum and somebody else reads it and like is impacted, right?
Mhm.
Like every single that's part of this mass.
Mhm.
I mean, started with a mass experiment, but now is like a mass movement of people sharing their stories and speaking up. And right, um it's all important, it's all worthwhile
I
in the
agree.
long run.
I agree. And if you zoom out a little bit and look at it, if you kind of zoom out from it, what's happening right now, like in the context specifically of psych meds, and I know this is happening around the world in many different facets. But when you zoom out, what is happening when given the opportunity, humans will galvanize and help each other. We also fight each other and war each other and do all those
Yeah.
things. But I think a critical percentage of people, our collective humanness, our common humanness beyond everything else, and well-being, health cuts through us all. I mean, it cuts through any divisions. We all bleed.
Yep.
We all feel pain. Um, we all want to be well, I think.
Mm-hmm.
So when you look at that and you pan back and you see what's happening, you see people are gathering and just sharing, and naturally that's helping. And then people are putting that information in and recognizing patterns, because it's all about pattern recognition.
Yep.
and then helping each other.
Mm.
It's incredible. And that's another thing too that was maybe a topic for another day about pattern recognition,
Mm.
how
Mm.
powerful that is for us to understand. Across humans you end up seeing these patterns, and there is variance, and
Yeah.
but and there are outliers,
Hmm.
but patterns we're not. Yeah, there's a lot of power in recognizing patterns when it comes to health, healing, well-being too.
Yeah. Yeah, definitely. Well, I think there's many things that I've in the back of my brain put a pin in to come back to in future conversations. Pattern recognition definitely one of them. Um, but as we kind of wrap up, is there any like, well, I guess I do want to ask if there are any closing thoughts that you want to add. I'll add one. Um, we started this conversation talking about the patient who came back to you just to check in and let you know how well she was doing, and this sparkle and hope and confidence that you saw and felt in her, and just the and how you're bringing that hope to other people that you're working with, saying like, I saw it, it can happen, like I've seen it more than once, it's not a fluke, like you can do it, kind of thing. And just sort of how that is, that idea, that ethic is radiating out into the whole process, and like hope for the future in ways that things will change. um yeah, it's been a very hopeful conversation.
Mm.
Yeah.
Hey, good. There's
Mhm.
all the hope. There's all the hope in the world. There's all the hope. Whether you're a patient or a provider,
Right.
there's all the hope. Trust
Or
yourself.
if, or a family member or whoever, like.
Yes. Yes. Just
Hmm.
trust yourself.
Yeah.
Trust yourself. You know. And then follow your intuition about that, about what you need, about what's going to help.
Hmm.
So you're most likely right.
Yeah, trust your gut, people. You got it for a reason.
All
Okay, we can sign off here.
right.
Um,